So my name is Dr. Patricia Kullberg, and I am a 1979 graduate of OHSU. I came of age at a time of tremendous hope, and a lot of people thought, we could build a different kind of society. I felt that coming from a place of privilege, that it was incumbent upon me to be part of the change, to try to contribute, to try to give back, to try to participate in building a different kind of society. I think women have a very important role to play in medicine. It's opened up the profession to the idea that to be a good doctor doesn't mean you have to work 80 hours a week. It doesn't mean that you have to neglect your family. It doesn't mean that you have to not have another life. And I think the entry of women into the profession in much larger numbers has been had a salutary effect on the profession. OHSU was a tremendous ally when I was in practice. I was very, very grateful for their support of practitioners who were working on the front lines with these difficult and marginalized communities. As medical director, I used to draw on a lot of the faculty here to come down and give presentations to our providers, and they were always very generous with their time. So I felt very fortunate to have an institution like OHSU in the community when I was doing that work. I started writing, to be frank, as a sort of self-therapy. After I retired, it occurred to me that these stories, many of them, were stories that really should be out for a larger audience. Not that I could be the mouthpiece or the voice for those, for my patients, because I think they need to tell their own stories, but I could illuminate my experience with them. It's especially important to be able to have some insight into what people's lives are like who are not like you. The patient that I cared for I think close to 2 decades, and we'd had an up and down relationship. He said, when I was in prison, they told me I was a psychopath. It was an authentic, genuine question he was asking me, do you think I'm this bad sort of person? I said to him, you've almost always been polite and respectful with me. And so I think that's a big part of who you are. It occurred to me that that's a very simple and powerful thing for me to do for people, is to simply feed back to them a vision of themselves that is of their best parts, and sort of, by doing that, inspiring them to be better people. All clinical encounters are very rich and engaging and emotional transactions. And they can be very difficult as well as rewarding. And compassion is something that you always want to bring into that encounter. If you pay attention, they will teach you a lot about themselves. They're like kids, interacting. Not that a patient is like a child, I don't mean it that way, but when you're interacting with a child, if you pay attention, they will tell you who you are. And I think interacting with patients was often like that too. If you pay attention, you'll learn about yourself. One of the biggest lessons that I learned in working with this population, which probably applies to working with any patient population, is not to make assumptions. That patients will always surprise you, and in ways that are both good and bad. But you need to keep an open mind about who the person is who is sitting in front of you. I worked in a clinic of last resort, and these were my patients. They came from across the street or from across the globe and from various spots in between. They were the dispossessed. They'd lost their homes, their jobs, their families, their friends and communities, and their homelands. They'd lost their opportunities, their prospects, and their civil rights, or they never had them to begin with. They'd lost their health. Some had lost their sanity as well. I was their doctor, and they came to me for help.